Namaste, welcome to Geeta's Kitchen. It is my privilege and pleasure to introduce to you all Dr. Deepa. She is an MD in internal medicine from the US and she has over 20 years of experience. And she deals with a particular problem which we find quite prevalent or we hear a lot about it nowadays, and that is autism. She has developed a lot of her time in researching autism and the associated comorbidities and the challenges autistic children face and how they can be included into mainstream society. She is doing a lot of work on this, and she reached out to me with the noble intention of helping so many parents out there who really want the right knowledge and the right help in dealing with their children. So, welcome, Dr. Deepa, to Geeta's Kitchen.
Thank you. Thanks for having me.
Sure. So, Dr. Deepa, now I'm a layperson, but we hear of this word called as autism quite commonly nowadays. And I understand that nearly 1 in 54 children is affected by this. Right? So now, can you just help us understand what exactly is autism?
So, actually, the recent statistics, they say it's 1 in 36.
36.
And these statistics are based...
itself is quite a big figure, right?
Right. And now it's 36, the latest one. And this data is based out of US. So, we don't have exact data from India. But I do hear that it's becoming more and more rampant, especially in big cities, and even in smaller cities, it's becoming more common nowadays. And that's what I hear from some of the therapists that I met, and also from some of the physicians, that it's becoming common even there. So this diagnosis itself is just based on symptoms.
Correct.
So we don't exactly know what's causing it. Usually in medicine, when you have a diagnosis, you usually understand what might be causing it and what are all the changes that happen because of that. And it's treated understanding that. But with this condition, there's nothing like that. Just based on the symptoms, like say if somebody is having, there are few criteria that they have to meet. And the main things are if they're having problems with communication, if they're having any restrictive behaviors or repetitive behaviors, and if they're having challenges with social interaction, they give this diagnosis, to put it in simple terms. There's a lot more to it.
Talk of something as ASD, autism spectrum disorder. So how is that different from autism per se?
Autism is the common term we use. Autism spectrum disorder is the whole thing. ASD or autism spectrum disorder is same as autism. They're all the same things. Just like we say television and TV, autism and ASD and autism spectrum, they are all the same things.
Okay, right. Okay.
Yeah. But the thing is, it's just like, to make you understand, it's just like fever, right? You can have fever because of various causes. You can have fever because of various infections. You can have fever because of some autoimmune issues. You can have fever sometimes in some types of cancers. You can have fever for various reasons. So similarly, this condition also could be because of various reasons. Okay. And right now, nobody knows for sure what it is. So once somebody has these features, once somebody has these conditions, it doesn't mean that, everybody is the same. All kids might not be having similar problems, even though their symptoms might fit into this diagnosis per se right now. So that's what we need.
Are there different levels under which you classify the children who have been diagnosed with autism?
Actually, they were using different terms before. Like you used to have PDD, NOS, Asperger's, autism, different terms they used to use before. But nowadays, everything is just called as autism spectrum disorder, ASD, right? But what many people don't understand is that it's based on symptoms, and a lot of these kids, besides these that are used to diagnose this condition, they have so many other issues that they struggle with, and those might be sometimes causing problems and challenges with these kids. Because sometimes when you identify those, first of all, to begin with, a lot of people don't even identify those. When you identify those, and then when you're able to find the right person who can address those, some of these kids start doing better, and their behaviors, whatever they call as behaviors, start improving. Their awareness starts improving. They'll start in general doing better. The quality of life of the family, the kid, in general will improve significantly. And so we really need to I feel that we really need to understand it more. We need to ask for more research, and some of the people who are researching feel that this diagnosis itself needs to be subtyped, because different kids have different issues. Okay. Not everybody will be having all the things that are being talked about.
It's very complex.
It's very, very complex, and it's very nuanced.
Okay.
And you need to understand that. It's very important to understand that.
Okay. See, when the baby is born, he looks absolutely normal, and the mother does not find any physically difference from a normal baby. It's only as he develops, then maybe there are some delayed milestones and things which causes concern for the parents. So can we say that it is not the presence of any particular trait or behavior, but the absence of these regular milestones which point towards autism?
Yes and no. Because the diagnosis itself is based on you finding certain things, right? You finding these repetitive behaviors, you finding these restrictive behaviors, you finding challenges with social and communication skills. These are the things that
delayed milestones or a delayed speech, onset of speech and things like that.
Right. But then what it really happens when you look at this is what the diagnosis is based on. But when you really look at the history of many of these kids, they're different. I mean, each one will have a little bit different history. So broadly speaking, you can say as two things. One, where the kid will be having delayed milestones from the beginning, from the birth itself, you will see that there's something different with this kid, right? They're not like other kids. And then there is another big subtype where they are doing fine. They're very nice, engaging, socially interacting. They'll develop all the milestones fine. And then later on, you slowly start seeing them going back, losing their milestones.
Okay, regression happens, you mean?
Regression. So there's a regressive type, and there is one where there's delayed milestones from the beginning itself, and then they will eventually be diagnosed with this diagnosis.
Okay.
So yeah, a lot of them do have delayed milestones, to answer your question.
So
that's not necessarily used in the diagnosis, but in the history you will see that.
Okay, so this is news to me, that the child can develop normally up to a certain age with all the normal milestones, and then there is a kind of a regression or going backwards. You mean he will start losing those skills which he has learned or something like that?
Yes, and for some give the history where they say, it happened very dramatically. Like, oh, he was doing fine, and then in the next few days he changed. And some, they will have a very gradual change. It's very hard to know that it was happening at the initial stages. You just think, oh, why is this happening? You keep wondering, but you will not really suspect much.
It can easily go unnoticed, right?
It can go unnoticed. And then some, they sometimes get this diagnosis, but then again they are able to get back to the they can get back to the normal track of development, and they might not be continuing to have this diagnosis.
So
So they might lose the diagnosis.
What you say, there is a lot of hope for these children. There is a possibility for them to get back on track and lead as normal life as other children too.
Well, that again depends. That's why I said we need to really research it more. We need to advocate for research, not say, we don't need anything. Because we need to understand what is it that's really making them get back to the normal track of development and catch up with their peers, and what is it that's not making them come back, and what is causing more and more regression in some. Some they continue to regress. So why is that happening? And is there anything to do, anything that we can do to help that and prevent that?
So yes, Dr. Deepa, I was wondering if you can tell us a few symptoms of the early stages of autism when the baby is very small. What are the symptoms the child might show?
So, see, one of the things, if you really look at the histories, diagnosis, you will see that if you keenly observe, you will see that milestones started getting delayed. They might still be in the range, but they were not as fast as, or they could be really getting delayed. And then they are becoming very, very slow in some of these kids, right? And they were interacting very well, smiling around 2-3 months, asking people around to come to them, interact with them, cooing and all. But that has slowed down, right? Some of these kids, they also will start having gastrointestinal problems, in the sense they might start having constipation.
Okay.
They might start having more colics than before,
Okay.
right? But that just because somebody has constipation or colic or doing this doesn't mean that everybody will have autism. But these are some of the things, if you look at the histories, sometimes you will see.
Right? So that means, can diet have an impact on autism? Diet.
What's that? Sorry?
Can diet have an impact on autism?
I think diet and lifestyle are fundamental things that we can work on. Some significantly.
Okay.
Right? And for some, there might foundations, and you need to do a lot more. You need to find a lot more things about what's happening, and you need to add lifestyle changes, environmental changes. These can be really powerful tools that parents use, right?
Mm-hmm. See,
today the diet that we eat is very different. What we sorry.
Yes, please continue. There's a small gap. Yes, no, please continue.
That we eat is very different from what we ate as kids and what parents and grandparents ate, right? There's way too much of and starting from
there's way too much of what?
Packaged food, processed food that we use.
Okay.
Right? And also, we don't know where the food is coming from. Like when I was growing up, and maybe when you were growing up, we knew the person who is selling vegetables from us. Where is he getting those from? We knew where the milk is coming from, right? Some of us used to go to the house of those milk walas, see them milk.
Then,
we used to know all this.
What you say, does it mean that autism is something which did not exist a generation ago?
It did, but then the number of cases were way less compared to now, right?
Or so it has been only recognized now?
No, I don't think so. Some people think like that, but I don't think so, because when I was growing up, I didn't see anybody with similar symptoms. And even in my medical college, when I was getting trained, I didn't see. A lot of physicians nowadays, they don't know much about it because they never saw.
So it has
Right?
become more common of late.
Yes.
Correct.
Yes. So let me show you. Actually, I don't know. Can you see this? Can you see this?
Yes, yes, I can. Prevalence.
Right?
Prevalence of
So you see
autism in
here,
a population of 10%.
1970s,
Okay.
late 90s, 2000s. Do you see this?
Okay, okay. It's just the graph is going right up over there. Right.
Right.
So
Do
it
you
was not
see
so
this?
widely prevalent earlier. Quite true, quite true.
Right.
Yes.
Right. When I was growing up, I never saw anybody. Even in my medical school, there was just like a paragraph of it that I read in my pediatrics book.
Exactly,
And I
exactly.
never saw a case.
Yes.
Right? I knew very little about it. Even today, if you see, there are many physicians out there who only know the textbook knowledge of what it is.
Okay.
Right? But they might not present like that all the time.
Is there any difference between boys and girls? Because somewhere it says that it is more prevalent in boys than in girls. Is that true, doctor?
Yes. Yes. As from the statistics that we see and the cases that we see, it's more prevalent in boys than in girls.
Okay, okay. And
But then it is seen in girls too.
seen in girls too.
And I don't know if it is seen by everybody, but sometimes I see that the girls are impacted more.
Can
in
it
some
have
cases.
a sudden onset in adults? Or is it only in childhood that you see it?
I don't think it is like a sudden onset in adults, but then I have met some adults who said that they felt that they are not able to mingle with others, and then they kept thinking about it, and then they got diagnosis then. But
Yes.
then
I've also read a few stories about that. True.
right. But then what I found is the autism that they are describing, right, and the autism which is affecting the kids now is a little different. I mean, like, you see some people talking about, oh, we are just, it's autism is our power, this, that, we are not suffering, there are no challenges, it's a superpower. Maybe, right? Maybe such people exist, but there are a lot of kids and a lot of children who are suffering and struggling and are not able to voice it. So we don't want such people talking about their condition mask the suffering and challenges other kids are having, right? So what that means necessarily is the whole diagnosis itself needs to be rethought, right? That maybe there are some where their issues is just social interactions and not being able to mingle with others and communicate efficiently like others. And maybe there are other kids who are having health challenges which are coming in the way, because some of these kids, when you address those comorbidities, they start doing better, right? That means the whole thing needs to be rethought.
They are not able to express their emotions.
Right.
What happens in society in general, once somebody is labeled, a child is labeled as autistic, people don't treat him or her as a normal child. And then this child feels left out and then is not able to express her emotions, and it leads to a cycle of events.
Right. It's a lot of trauma for some of these kids and families also. So the first thing I want to talk about here is addressing the person itself, right? So some people like being addressed as autistic, but some don't. And I personally don't think it's the right thing to do. That's a person with autism, not an autistic person. That's what I would think. And there are many families who don't want to be called autistic. That's a kid with autism, not autistic kid, right? That's not their identity necessarily. But there are certain people who want that to be their identity. That's okay, that's fine. But before we know, we should not be calling them as autistic, right? Autistic kid. We should say a child with autism. That's what I.
Okay. How much does genetics have a role to play in this?
So there's a lot of research money that went into genetics, and they found that not many cases are because of genetics by themselves, right?
Okay.
Very few cases. Because even if you think about it, right? I showed you the prevalence, right? If it is genetic, you won't see such rise all of a sudden now.
Yes,
It would
yes.
have been there like that even before.
Maybe other environmental factors like pollution, pesticides and used in farming and things like that could
Possible.
possibly be. We do not know. There's not enough research.
Possible. Lot of people nowadays, I mean, there's a divide, right? Some people from their experiences and what they are seeing, and there's also some evidence where it is thought that environment could be playing a role. It's called epigenetics.
Okay. What about
Something about genetics.
chromosomal conditions? They also contribute to that?
Yeah, but they're, like I said, there are very few. Like,
Very few.
let's say 100 cases, you will see less than 20 or maybe around 20 at the max with that. But 80% or even more nowadays, they don't have anything in the genetic studies that you will find.
Genetics. What about certain medicines taken by the mother during pregnancy?
So there are certain studies which say that there is a possibility that advanced age, the stress and the diet and the lifestyle during pregnancy,
Because some mothers have gestational diabetes.
premature births, and yeah, that they could be playing a role, but we don't know for sure. Basically, it's not one thing from what I understand and what I see, and from my interaction with others who are working in. It's yeah, it's like so many things coming together like a perfect storm, causing it.
Okay, low birth
Right,
weight.
but not always, but possible. Like when somebody has, what it is it's like a predisposition. You have a greater chance if other things also happen on top of it. When you have certain things, it's like, even nowadays, if you look at medicine, the recent developments, lot of times, lot of these conditions, right? People say, oh, hypertension runs in my family, so I have it. Diabetes runs in my family, so I have it. But it's not necessarily true.
Correct.
Right? There are so many things that when you modify, you can prevent that from happening. This is all the new branch called epigenetics.
Okay.
About genetics, there's a lot more, right? So what they say is genetics is like a loaded gun. And the environmental factors and diet, lifestyle, all these things are like the trigger. Only when you pull the trigger, the danger from the gun comes, right? Otherwise, you have a gun, you're fine, it's safe. Only when you shoot. So that can be nowadays.
Why I'm asking you all these various points is parents of children with autism very often feel somewhere they feel maybe I am at fault. They have that sense of guilt. They feel, am I at fault? Am I the reason for this? So I would personally want you to please tell all the parents out there that this condition of autism in their children is definitely no one's fault. They have not done anything personally wrong for the child to be undergoing this. Correct? Otherwise, there's a lot of stress and trauma which the parent also undergoes.
Right. Yeah, that's very, very true. And it takes long time for the parents even to recover. The diagnosis will cause so much change in their life that it's unbelievable to mention, right? Their life, it turns upside down, right? And it's very, very hard to adjust. There's a lot of grief that happens. There's a lot of trauma that goes unaddressed in these parents, which by itself will cause a lot more problems, right? There's a lot of guilt that maybe it's because of me, or maybe I could have done this, maybe I could have done that. But all these things, maybe you could have done something else, and maybe it could have been different, or maybe it could not have been different, right? But what happened in the past cannot be changed. And had we known better, we would have done better, right? We always try to do the best we can for our kids. We go to any extent to do the best, and we'll do what we think is the best or what we knew is the best, right? And not necessarily always you will know everything that's out there.
So
that
now, what hope is for them? What do you think? Just to sum up, because we don't have much time left. To sum up, what do you think the steps these parents should take? Parents who are facing, autism in their children, right?
So I think the first thing that they need to work on is themselves. They need to address their trauma first,
Correct.
because unless we do that, we cannot really help others, right? We need to take care of ourselves first if we want to help others.
Exactly.
So first thing I think, which is very, very neglected also, is self-care.
Absolutely.
Parents should take care of themselves, their feelings, because once the diagnosis happens later, you are constantly running from one therapy to the other therapy after you overcome the grief, and you never take care of yourself. I know families, I've seen families in India where, their day starts in the morning, they have an auto or a cab that they book, right? And throughout the month, they will be taking them. They eat in that car, one therapy to another therapy to another therapy. Their life, the whole morning when the kid is awake, is in the car. They eat also there, it seems. So, and then they're tired by the time they come home, and they never address their issues because they think, okay, now if I do this, or they're always worried that if I miss out on that therapy, if I miss out on this therapy, and they keep jumping from one thing to the other. Whatever comes to the market, they keep jumping. Okay, let me do that. But then you don't have time, right? So what they do, they'll stop whatever they're doing and they'll jump onto the other thing because something worked for some other kid. But it's not like that.
So the proper guidance is required. That is very essential.
Right. And whatever therapy comes out there, the problem is also everybody will portray or market it as though theirs is the best, right? And when something works for one kid, everybody wants to do it. But like I said, all these kids are different. Their needs are different. Their levels of severity is different. Everything is different. So it needs to be personalized. But there are certain things that will work, that need to be used for all the families, all these kids. They can be used for all of us also, but especially more important for these families and kids.
Mhm.
Those are diet,
Okay.
lifestyle changes, environment. We need to clean up our diet. We need to change our lifestyle for better. We need to change our environment in a way that will be conducive to our health and development.
Doctor, you said you have been working on personalized treatment for quite a few families, right? Have you found any improvement by these changes which you are now recommending?
Yeah, I did. Some people, they see significant changes with just diet and lifestyle. Some might not see significant ones, but they will start noticing. But it's no magic pill. It's not like you go take a Tylenol when you get fever and then 2 days you're fine. It's not like that. It needs time, months to year. You need to do it to see. But you will see in few months, if you really do it, you will see things changing, right? Because a lot of times people go to therapies and they feel that, oh, I went for a year, I went for 2, and nothing is happening.
So when they see things happening, that will make them do more, right? Follow it more.
Right. But the other thing that you also need to know is when things are not working, when the therapy is not working, that means something is preventing the child to catch up, right? And most likely it is medical issue.
The kind of personalized treatment apart from therapy, what you were saying about diet and lifestyle, that you will see improvement. Once they start seeing that improvement, then they will naturally tend to do more of that change.
Right. But I want to also pass on this message. So where, even if you don't have access to physicians who are trained in this, because not everybody is trained in this, and the knowledge on this topic is evolving and emerging every day, and to catch up with new things in medicine is really, really hard and very, very expensive. Okay. Right? To go to those conferences, all the way travel to other countries, it's hard, and you won't have. So in such cases, you need to I believe that it will help significant number of families and kids if we start doing dietary changes, lifestyle changes, and cleaning up our environment, right? And I feel that this is a message for all of us. Like these kids are coming up with a message.
So, in detail about these changes, what you're telling, many of the parents might want to contact you personally because each child is different from the other, as you said. So, I think we can provide your details, your email details in the description box where they can contact you on a one-to-one basis to get a clearer picture of what kind of therapy or what changes might help them. Is that right, Dr. Deepa?
Well, yeah, you can. But before we go to that, I want to say certain things that these parents can do. Right.
Yes.
One of the things that a lot of research is showing is a lot of these kids benefit from gluten-free, casein-free diet. So what does that mean? Gluten, it's commonly found in wheat, but it is also found in other things like barley, rye, and other stuff. If you type in gluten and grains with gluten or products, food items with gluten, you'll get a list. Eliminate those things first, right? And other thing is casein. Casein is a protein that you find in milk, dairy. So try to eliminate that and see. So it's lot of, it's not that easy also, because a lot of these kids, they don't eat everything. They also have issues with picky eating, right? They don't eat like every other kid. Some, they are very particular. They want only particular texture, only particular brand also. So it's very hard to wean off, but you have to gradually try, and that will help a lot of kids. And when doing it, you have to make sure that it's not getting the protein is not getting in through other means. So packaged foods and all, avoid them, because a lot of times when you buy things, there's a food label that's written in the back. Certain things are mentioned, but certain things you don't even need to mention when the quantity is minute or whatever. But then there's a chance of that coming in through such foods. So whenever possible, do fresh food and home cooked food. Do at least for 6 months before you give up, right? And when you're doing this, make sure that you're not nutritionally, the kid is not suffering nutritionally. There are so many other ways of providing that food, right? To begin with, in South India, rice, millets, these are commonly used. So use those and buy organic food, at least for these kids, right? Because there's a lot of pollution, pesticides, herbicides that are used. And there's some research saying these also will affect your gastrointestinal tract and immune system. There's so much research out there saying that it's better to avoid these. So gluten-free, casein-free diet, if possible, do gradually. Organic food, right? Healthy lifestyle, meaning what else, right? Avoid processed food, avoid packaged food. If possible, we said we don't even use soy. Reduce sugar in their diet, especially chocolates, all these biscuits that you buy in India, cream biscuits, this, that. There's also, they feel, there is some research and they feel that the neurotransmitters in some of these kids are imbalanced, right? There's some of these kids you see are hyperactive. So there's this high level of glutamate that comes in. So MSG is one of that. It'll increase the glutamate. Some of the processed foods will have different ways in which they put that in. They might label it as different things. So avoid those things. And then follow the rhythms of the nature. What do I mean by that? Go to bed early and wake up early if possible. When the child wakes up, a lot of these kids will have issues with sleep, right? That's a huge topic in itself. So for that, but the basic things that you can do are, when you wake up, go out, get exposed to the sun. That will set our melatonin cycles, the sleep cycles. It will help to set them right. When you sleep right, when you get exposed to the sun in at a certain level, at the foundational level, it will help. So do that, and try to make them walk in nature, like in the garden where it's pesticides are not sprayed. Place fresh air, ventilate your houses. So because there's some research saying when that might not be a problem in India, because it's not a closed system like in US and other developed countries where it's air conditioned and always closed, right? There's a lot of toxic chemicals inside if you don't ventilate that happen. That there's a possibility for that to happen. They feel that the outside air is much cleaner than the inside air because of that. There's some research saying that. So do that. Ventilate your house. Expose your child to nature. There's something called earthing that happens when you walk outside in nature, barefooted in a clean area, trees and all. Nature has immense potential to heal all of us. It's unbelievable when you look into the research, right? Nature always wants us to thrive. If we look around and see, we'll see so many patterns. If you do gardening, you will see I learned a lot from gardening. When a child is not doing well, we always try to correct the child, right? With autism especially, we'll say, you behave like this, you behave like that, but we'll never look deep into why the child is behaving. That needs to be addressed. Whereas with the plants, we don't do that. When I'm gardening, when the plant is not doing well, I'll try to find why is it not doing well. Do I need to put in that fertilizer? Is the plant lacking this? That is what we work on. Same thing needs to be done here. So those are some of the lifestyle changes. It can take hours if we talk about it. And then the other thing is the environment, the products that we use, the personal hygiene products, soaps, shampoos, perfumes, all these things, they should be cleaner. A lot of these have a lot of chemicals which can add to the burden on our system, right? We all have limited capabilities to detox. And some naturally, they're gifted with greater ability, and some naturally are gifted with abilities where, they will react even to a lesser level. And I believe that it's the way nature has set so that, we will correct ourselves whenever things go wrong. I see people with all these who are sensitive and who get affected as gifts to all of us. They're telling us, okay, we need to change things. We need to protect ourselves. See, I'm suffering. Soon you will suffer if you don't follow and do something. So these are the basic things I want people to know. And this can help significantly.
So then now we are just about 2 minutes left. How can people contact you so that any other doubts, you are a medical person, so how can they get their doubts cleared, in what way they can improve the life for their child? So what is your contact details? If you can, they can get in touch with you on your email.
Well, I'll give my email that you can put in the description if they want to contact me, or if there are many who would like to know a little bit more, maybe I can try to create a course, but it depends on how many really want to do it, right? I can, because it takes immense time for me to.
A lot of feedback in the comment section when I upload this video. So maybe you can help a couple of them out by responding to those comments also. And from there we can see how many more really need help, and you can, because that was the aim of this video, right? We started out by.
The aim is to let them know that, we think that there's nothing under our control. There are things that are under our control, and sometimes these things by themselves can help, or sometimes they might help a little bit, but even a little bit of improvement in these kids is precious. Yeah, you will see that when you address the medical issues, the therapies start working.
Okay.
Right. And communities need to talk about that. Maybe we'll talk some other time if people are interested in knowing about it, about inclusion and about how community can help some other time.
That will be great. That will be great. So thank you so much, Dr. Deepa, for your valuable time. And thank you all for watching this video. We really hope that you find it useful. Please let us know in your comments so that we can see how to take it forward from there. We'll meet again in another interesting episode from Geeta's Kitchen. Thank you.
Thank you all for listening, and please do share this information if you know somebody who might benefit from this information, and not only for this condition, but for so many other conditions. Almost every condition, you can help yourself by making changes in your diet, lifestyle, and taking care of the environment around us. So please do think about it. Thank you, and wish you all good luck.
Thank you so much.